Hi there, this is Dylan, and I've decided that, in spite of what I said in my last video, I'm going to post a bit more prolifically right now. I see no reason why I can't talk more and still be extra careful. So, I'm making this video to just kind of give an update. Some things have happened in the last couple of days that I think are worth talking about. To start with, I am in a motel right now because I apparently tested positive for COVID. I went to the emergency room yesterday because I was feeling extremely sick and also thought that I had pulled a muscle in my side that was making it really difficult to move around. Turns out apparently that is from also having mono. So as you can see, I look like shit and I feel like shit. And yeah, this is lame, but it's also nice to be inside for a little bit. And when I did the intake here, they told me that they might be able to connect me with shelter referrals for when I leave. So hopefully I won't have to go back out onto the street after this. So something that I want to talk about, and I'm feeling my dissociative system reacting to triggers very heavily inside, trying to shut me down. So I'm going to see what I can say here. I can feel myself reversing internally as if I'm going to... It's really hard to explain. MK is very difficult to describe sometimes, but I can feel things happening with alters reversing, turning around, like they're going to pass out after doing so. Anyhow, I'm going to push through it, and I'm going to try to talk about something that happened yesterday while I was in the hospital. I was lying in a bed, and I had an IV in my hand, and it's happened to me repeatedly that if I'm in a hospital and I have an IV in that's connected to something, I have a horrific panic attack. I regress to a really young age, and I completely freak out from a sense of confinement and from traumas involving very painful things being put in the IV and frightening things happening while the IV is in. So yesterday when I had the IV in, and I was, as far as I can recall in the moment, alone in the room, I suddenly became extremely young inside and began silently or quietly, like kind of whisper screaming, and felt just pure terror. And I saw basically the totality of my life as an MK, an ultimate sense of futility in ever escaping, an ultimate sense that I would never be someone who had not been subjected to dissociative programming. And I felt my homelessness completely. I felt the sense that I couldn't possibly fathom going back out onto the street, that I did not know how I have been surviving up to this point on the street, the level of pain that I've been in outside. My system has not been able to obtain some really basic supplies that would make street living easier. Compared to some people, the way that we camp is nice compared to what we really need in order to cope and what some other people are able to pull off outside. It's still been horrible. And so anyways, in this moment, we just really, really felt it. It was just absolutely excruciating, some of the worst pain I ever felt. And I'm wary of saying this, but I will go ahead in this moment. I will say that we thought about suicide, and then we were able to deep breathe. The Ativan, I think it was, that they gave us kicked in, and so the screaming stopped, and then whatever happened after that probably helped, quote unquote, helped us to stay out of that place inside on a conscious level. But it was definitely an experience to feel that kind of core awareness. And it reminded me once again of why the deprogramming process has to be a slow one. I'm not trying to tell anyone else what to do. It's, I think, always up to the individual to determine the pace. That being said, that actually brings up something that I have also been avoiding talking about, largely because I was so completely traumatized by it pre-testosterone. I really couldn't conceive of speaking of it, but the testosterone starting to help with this, and so now I feel a little more able to speak on it. I'm speaking as an autistic person here. There's something that we call collective deprogramming that we specifically have been experiencing with other autistic MKUltra people, in which the psychic abilities that are trained from childhood, as well as innate, I believe, in people who are naturally sensitive, these abilities lend themselves to a more collective experience of consciousness that I have been trying to work with as delicately as possible to help the deprogramming process take place with other autistics as a group. The entryway to this process has largely been simply becoming aware of the collective psychic programming, in which hypersensitive MKs are grouped together, sometimes specifically in pairs, and I have touched on that, I believe, in talking about something called twinning. But it also happens in groups, and becoming conscious of the ways in which these innate and then enhanced psychic abilities are used to program each other. We're used to program each other, through these abilities. Sorry, it's hard to speak on this because there's a lot of trauma, and I'm afraid to for a number of reasons. But yes, becoming aware of the way that this is used and having a conscious experience of this and trying to pull back from forced perpetration using psychic infiltration of other slaves, it makes it possible to potentially find a relationship with other slaves that is more consensual and may make it possible to deprogram together. And it's extremely delicate because I'm aware that if I have been made to perpetrate on this level, that whoever I have been made to harm may not wish to have any connection with me at all, and I may have to pull back completely. But at the same time, if I pull back completely, it can set off more programs, both in myself and in the other people, that could lead to more harm. And so, because of the psychic enmeshment that the largely sociopathic programmers and handlers try to instigate and make use of in the autistic slaves, it actually kind of forces us to deprogram together. So it's a very strange and brutal and beautiful thing, in my opinion. And I'm really trying to work on finding my flow, if you will, with this process. I forget why I brought that up, but this is something that I've been really wanting to speak on because I've been going through horrific trauma with this. The estrogen in my system, if it's too much, it makes psychic shielding very difficult. Perhaps if I had a house and was being accessed less and was able to sleep more, I could shield more. There are so-called magical tools that I know can help with that. After my recent relapse on methamphetamine, which I now have a little over 3 months of sobriety from, I think, 3 or 4 months, something like that. My system has been shutting me down around collecting the more legal kind of crystals, but I do know that crystals can help with that. Quartz, just basic quartz, can help with that. But yeah, in terms of mental defense, psychic shielding, my energy levels have been so down because of the homelessness and the accessing and lack of nutrition, as well as not being on testosterone. It's been very, very difficult. But since I started testosterone, I'm finding myself much more shielded, much less conscious of psychic attacks. I lowered my dose a few days ago, and almost immediately, within, I guess, 2 days, I started to really feel the dose wear off, and I became extremely conscious that I was being psychically infiltrated by other sensitives in a way that was unbearably painful. So I am both very grateful for testosterone in this way and also saddened because, well, it's part of male privilege to have that defense, and at the same time it will kind of serve to blind me a little bit to what effect I might have on others, particularly people who are female and sensitive. So this is something that I'm going to be working on consciously and I'm going to be using my experience as someone without as much testosterone in their system to try and just be as present as possible and remember just how much effect my thoughts and intentions really can have on other people. Okay, I'm going to try not to talk more than 15 minutes per video, so I'll leave it at this, and hopefully this helps people to understand more about MK. I know how triggering this particular video may be, so I'll try to put extra warnings. Thank you.